Hello friends, welcome to AI Medical School. In this video we are going to study urticaria. First of all, subscribe to the AI Medical School and hit the thumbs up. Urticaria is a very common disease and is a vascular reaction of the skin characterized by the appearance of wheals. White or red temporary plaques are generally surrounded by a red halo or flare and associated with itching. Etiology. Many factors can lead to urticaria, but there are many patients who have no clear reasons. The followings are possibilities. 1. Foods are a frequent cause of acute urticaria, whereas in chronic urticaria food is a less frequent factor. The most allergenic foods are shellfish, shrimps, crab, chocolate, nuts, peanuts, tomatoes, melons, pork and cheese. Eggs and milk always induce urticaria in children. 2. Medicines. Many medicines can cause by allergies. The most common drugs are as follows: penicillin, serum, vaccine and so on. Sometimes a few drugs can directly stimulate mast cells to produce histamine, like aspirin, morphine, cotton, quinine and etc. 3. Physical factors. Cold, hot, sunlight and pressure can arise urticaria in some cases. 4. Infections caused by all organisms are another possible reasons to induce urticaria. The most common organism is the virus of upper respiratory and Staphylococcus aureus. Chronic infections of the patients cannot be easily verified as the pathogen of urticaria. It must be tested by therapy. Number 5. Spirit factors. In some cases, stress can trigger urticaria, but in another case stress may lead to histamine releasing. Number 6. Animals and plants. Urticaria can be induced by an animal's fur, skin or pollen or the stinging of insects. Number 7. Diseases of internal organs. Rheumatic disorder, rheumatoid arthritis, systemic lupus erythematosus, malignant tumor, disorder of the endocrine and some others can be another reason for urticaria, especially chronic urticaria. Clinical manifestations. Urticaria is the most common disease in dermatology, with about 15% to 20% persons who will experience one or more occurrences in their life. According to the course, it can be divided into two sorts: acute urticaria and chronic urticaria. Acute urticaria can be cured in a short period, and chronic will always keep for several months or several years. Acute urticaria always occurs. It will evolve over days to weeks, producing temporary wheals that rarely last more than 12 hours. With complete resolution of the urticaria within 6 weeks of onset. Sometimes it will show allergic shock. The blood pressure of patients may fall, or they will have abdomen ache, or are panicky, nausea and vomitus. Dyspnea will appear in some cases if edema appears in the respiratory tract. In a few cases it may be accompanied by systemic symptoms. Chronic urticaria. General symptoms of chronic urticaria are mild. More wheals or a few wheals. It will recur repeatedly, keeping for several months or years. It will sharpen in a special time or not. Causes cannot be found in many cases. These are some pictures of it. Special sorts of urticaria. Angioedema. It is a form of physical urticaria. Localized edema is its feature, and it may be inherited or acquired, but inherited types are rare. It always occurs in rarefaction areas, like eyelid, lip, external genital organs, hand and foot. Appears abruptly and shows localized edema features. It will diminish after 1 to 3 days. It always occurs repeatedly. If angioedema appears at the mucosa of the larynx, it can cause dyspnea, even death. These are the pictures of the special sorts of urticaria. Diagnosis and differential diagnosis. The diagnosis of urticaria can be made on its typical clinical manifestations. In detail: wheals, fast appearing and diminishing, no trace after diminishing, and specialities at every phase. It can be diagnosed easily, but cause diagnosis is very difficult in many cases. Systemic treatment. Acute urticaria. The main treatment of acute urticaria is the administration of antihistamines. Sometimes it is needed to unite 2 or 3 antihistamine drugs together to therapy acute urticaria. Vitamin C can also be used to decrease the permeabilities of vessels. If it were accompanied by an infection of bacteria, appropriate antibiotics therapy would be necessary. If it is followed by shock or laryngeal edema or dyspnea, immediate injection with 0.1% adrenaline at 0.5 milliliters by subcutaneous part may save the life. Inspiring with oxygen. Meanwhile, intravenous injection with hydrocortisone at 0.2 to 0.3 grams in 500 milliliters glucose is necessary. After about 15 minutes, 0.1% adrenaline at 0.5 milliliters can be used again. 0.2 grams aminophylline is used for cases with bronchospasm. Chronic urticaria. Looking for the real reason is very important. And corticoid must be avoided. The mainstay for treating chronic urticaria is the administration of antihistamines. These should be taken on a daily basis. They should not be prescribed to be taken as needed. The patient should be warned about driving an automobile because of the tendency for drowsiness following the use of first-generation antihistamines. Second-generation antihistamines cetirizine, loratadine and acrovastine are better for these patients. After wheals disappear, antihistamine drugs need to be used for more than 1 month. If one drug is not effective or ineffective, 2 or 3 antihistamines being used together can sometimes have a good effect. For some refractory cases, if H1 antihistamine drug is not effective, the H2 antihistamine drug can be chosen for combined treatment. Topical treatment. It can be treated with calamine lotion or diphenhydramine. Thanks for watching, I hope you liked it, see you in the next video.